Families are already thinking about trick-or-treating in the age of coronavirus, and the CDC has some recommendations for parents before they take part. Joining me now is CBS 4 medical editor Dr. Dave Hnida. Now, Dr. Dave, the CDC says trick-or-treating is too high risk right now. What are your thoughts on these guidelines, and really how can kids celebrate Halloween safely?
Yeah, welcome to the 2020 version of Halloween, where I think we're all just trying to figure out what the heck are we going to do this year. They have said that trick-or-treating traditionally as done is really a higher risk activity, so they have had some recommendations. And those recommendations include things like saying that the traditional door-to-door trick-or-treat really should be out, that there really shouldn't be these community costume or Halloween parties. Things like haunted houses should probably be avoided. Going out with people you don't know and doing a hayride or a tractor pull, probably not really the best of behaviors at this point in time.
One-way trick-or-treating.
Instead, they're saying try to make things a little bit more family-oriented. They're recommending that if you are going to give out candy, that perhaps you do individual little party bags and you can put them on your driveway or sidewalk or so on and so forth for anyone who would come to your home. They also say that you should perhaps have family-oriented activities like pumpkin carving or maybe scary movies and so on and so forth. Everything really is based on staying within your own group of people that you live with, so that there is a lower risk of spread or catching something. The other thing to keep in mind here, this is really kind of important, is that if you are going out and trick-or-treating, remember a Halloween mask is going to provide you zero protection for yourself as well as for others. And so I think the recommendation or guideline there really is to have a protective mask that is Halloween themed, perhaps. That would be a little bit safer. Incidentally, really quick note on this one that I noticed is that candy sales, particularly chocolate, are way up this year already. And I have a feeling it's us grown-ups that are eating it rather than saving it for the kids. It's been a rough year.
Yes, exactly. We can all enjoy all the candy and sugar we can get, right? Well, we're switching.
Yeah.
Yeah, right. Now, let's talk about Boulder. We know CU Boulder has been dealing with an outbreak, and there's now a new public health order that really bans gatherings among 18 to 22-year-olds. So do you think that this will make any sort of difference?
Boy, this is a tough one because, first off, I see this and I put myself and say, okay, Dave, you're 18 to 22. How would you act in a situation like this? Then I think of myself as a parent of an 18 to 22-year-old. And I go, boy, this is really hard. This is rough what is taking place right now. But then I go into doctor role and take a look at it from a public health standpoint, and I say, boy, this really does seem like a necessity. When you look at the number of cases that have come up in Boulder, I mean, it's a huge number of cases. 80% are related in some way, shape, or form to the university. It is the largest outbreak in Colorado since March the 3rd, earlier this year. And the big concern, obviously, is, well, maybe college-aged kids can handle this, but as soon as it goes out into the community, we've got a major problem. This has been seen in other states, in other cities, other areas. So it is certainly something that is a protective measure that is necessary. Now, a lot of people say, well, this is really drastic what you're doing here. Is it even legal? And actually, it's very legal. You would be amazed at what the power a county or a state health department has when it comes to enacting public health orders. I know there are a lot of people who are arguing about mask mandates and personal liberties and this and that. Those are not even close to being as far as you can go in terms of mandatory quarantines, mandatory stay-at-homes, so on and so forth. The Constitution does grant that authority to health departments in the interest of the public health. So it is a legal maneuver, and it is, once again, permitted under the Constitution. Here's the bottom line. Hopefully, it is mandatory because voluntary behaviors were not followed. Hopefully, those mandatory behaviors will, or mandatory mandates will go away. Voluntary behavior will improve, and things can get back to some sense of normalcy in Boulder in the time to come. It's going to be good for the students, going to be good for parents, going to be good for the community. It really is something that's very important.
Yeah, we talked to a restaurant owner out there who said this is going to continue to keep happening until people just kind of stick to what they're supposed to be doing for a little bit and let them get out of this wave. So
Yeah,
it's very interesting.
it's so hard.
Absolutely. We've also been talking to you a lot about the race for a vaccine, but none of the trials currently underway involve children. So do you think developing a separate vaccine for children is something they should be looking at or something that's important?
Sure, it is important. However, it's going to take a even longer time than what we're seeing with adults. Typically, when you develop a new vaccine, what you do is you begin testing it for safety and effectiveness on younger, healthier people who have no issues. And then you gradually work your way down the line. You take a look at older people, you test it then on people with chronic underlying conditions, minorities, and then last you wind up going to children as well as pregnant women, because you really don't want to be testing a vaccine on that group or those groups until you wind up testing it on other folks. And so it really is a matter of safety and effectiveness before you even go near testing kids. You have to remember, little kids are not just simply miniature adults. Their immune systems work totally different. And so when you look at vaccines that are tested and administered to children, they often are in different doses that are given to adults. In some cases, when adults and kids do wind up using the same vaccine, the dosing sometimes is higher in children, sometimes they are lower. And when you go in history and take a look at children's vaccines, all of them were first tested in adults before they were even given to kids. So there is a long road ahead. There is some talk and some preliminary testing going on. There is some stuff going on in some other countries, but realistically, I don't think that it is going to be anytime soon before there is a vaccine, and most experts are hoping that for children, there will be a vaccine available by the start of the school year in 2021. It's going to be a while.
Wow, yeah, just fascinating stuff. Dr. Dave, thank you so much, as always, for joining us, and we'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. To see all of our Q&A with Dr. Dave segments, you can visit cbsdenver.com.